Hi, Rosella. Wonderful to meet you. Would like to begin with by getting to know a little more about yourself and about the work that you do and about your organization.
Good afternoon, morning, everybody. I'm Rosella Micco, and I'm the president of an Italian-based organization called Emergency that was funded back in 1994 by a surgeon, Dr. Gino Strada, who was a right livelihood laureate back in 2015 for the work that Emergency has been doing. I have personally been with Emergency since 21 years. So dealing first with our operations in the field. We mainly work in the health sector, from war-torn countries, Afghanistan, Iraq, Yemen, to countries in Africa where we try to strengthen the health system, Sudan, Sierra Leone, Uganda, Eritrea. But we've also started a project in Italy back in 2006, where we have started to deal with the right to healthcare for migrants and vulnerable groups. Initially thinking that our work would mainly focus on foreigners who had no access to our public health service, but then slowly we realized that there were also a lot of Italians, vulnerable people, marginalized groups that did not have access, despite the fact that our constitution entitles them to have, by constitution, the right to a public health system. So over the years, we have expanded our activities, and we have been also very much involved in the response in Italy to the pandemic, to the COVID-19 pandemic. Italy was one of the countries that was hit heavily initially since February 2020. By the outbreak, particularly the region where Emergency has been based. That's Lombardy, Milan, where I'm talking from right now. And this has been quite a big challenge for us. But we have actually, let's say, implemented the same principles, the same values that we have been implementing all around the world for the past 27 years, also in our activities here, which are basically something which is for us quite, let's say, obvious, but at least should be in theory, but in practical terms, it's not that easy, which is to practice equality as it has been stated by the Universal Declaration of Human Rights, so that every human being is born equal and free in dignity and rights. And this is exactly what we try to practice daily in all our hospitals worldwide, as well as in our health and social activities in Italy. We have a lot of things that differ from one human being compared to the other, but at the same time, we have to believe that we are equal in dignity and rights. And the other thing that is very important that the Declaration of Human Rights states is that is the recognition of this equality in dignity and rights that is the foundation of peace, freedom, and justice in the world. So we as Emergency have a double mandate. On one side, to provide healthcare quality and free of charge healthcare to all those in need, but at the same time to promote a culture of peace, solidarity, and human rights. And the two things are like the two sides of the same coin, because without having access to right in a dignified way, without giving back dignity to every individual, we will not be able to have a world where peace, justice, and freedom are present. So
can I take up that two-sided coin that you just introduced and ask another follow-up question on that, relating to how it allows you in Emergency as a group taking these principles of sort of a rights-based approach to health, how it allows you also to see all the diverse ways in which people are denied rights in this crisis. So you see this, the emergency of the pandemic, right? But you bring this approach where you are very interested in how people are denied rights to health in the broadest sense. And has that enabled you to see, in the context of the crisis, its multiple formations, its multiple causes, in ways perhaps that other politicians and leaders don't always see?
Well, definitely, this crisis started as a health crisis, but it was very clear quite soon that it was not just a health crisis, but it was a much broader social and economic crisis. And still today, I think that we are still dealing with a lot of problems, at least here in Italy, with the consequences of this in multi-sectorial pandemic. I think that we were not prepared for such a big boom. And still the idea of a pandemic, which means that is a crisis that is affecting every single one of us, regardless our economic status, our geographical position, our gender. I mean, it's really something that that is having a global impact on each of us. Has given us more challenges to deal with. We have heard since the very beginning that we will not be safe until anyone is safe. This was something that we really believed in a lot, and I was really so optimistic about that. But in practical terms, we have seen very little in order to make sure that all of us are safe at the same time, or let's say in the shortest time as possible. Internally, for example, in Italy, we have seen a response that excluded all the vulnerable and marginalized groups of the society. I think about the homeless, the migrants. First, when there was like no correct information or multilingual information regarding the pandemic. Then in the second phase, where we started to have vaccines, and these groups were excluded from the proper access to vaccines. At the broader, large scale, the same is happening with all the low income countries that at the moment do not have any real significant access to vaccines. And we firmly believe that until we don't find a way, we don't find solutions that are really inclusive, we will never be able to overcome this pandemic. In Italy, we have been able to have an impact on this situation. Even we have, let's say, promoted sort of we could call them social innovations in terms of mobilization of community, young people, also very rooted in their own small territory. But these are just examples of how things can be done and can have an impact at a larger scale, as we have seen it here. But I think that the willingness of the communities and ordinary people need to be matched by the political will, because that is something that that has the power to drive the decision. And I think that unfortunately at this stage, I haven't seen this very strong will and courage to go into really inclusive directions.
Yeah, just very interesting. You're talking of the multiple complexities and the ecosystem within which you're trying to engage, and these intersections that are there. So within this multiple intersections, how do you see the deepening inequalities and therefore the differential impact of the crisis, and therefore, how do you therefore practice equality, and how challenging it becomes within this context, and of course within a larger context of where the political will could be less, and a larger challenge. Yeah.
Well, yeah, I still believe that this pandemic can be an opportunity, that this crisis can be an opportunity, because if we don't miss this chance, this can be really become the driver of one of the most important changes in terms of overcoming the huge inequalities that we are facing among different countries and within the same country, among different social groups. For example, in Italy, we, being a health organization, of course, we were immediately involved in the health response. And we did it not only by setting up medical centers, intensive care units to treat COVID, but also by training institutions, public and private institutions that were dealing with people or communities who might be affected by COVID, in how to deal with it, the guidelines, the protocols, IPC, and so on. And by doing that, we met people who had also other needs, not just the health need. And at the same time, by meeting their needs or understanding what their needs were, particularly in terms of new poverties that were arising because a lot of people lost their jobs, we at the same time found a lot of energy, particularly in the young within the communities, who wanted to help, but they didn't have the skills to help in the right way, because we don't have to forget that what we were told was to keep the social distance. Yeah. So was to stay far away one from another. So by training the communities, we were able then to match also the young energies that could help and support those who were heavily affected by the pandemic. And with our, let's say, experience, logistic knowledge, and resources, we were able to multiply this help in many different cities, adding also emergency food aid to health services and counseling in several cities in Italy. So this could be a very cheap, let's say, model that can take into consideration in an holistic way the need of the individual, and at the same time mobilizing the resources, and then become a model that also the municipalities or the public entities could then support and endorse.
You've already begun to answer the next question I wanted to ask, but let me just sort of rephrase it a little and say, one of the things we really wanted to explore with you is, how do we seize the opportunity to respond to the crisis and make it into a larger opportunity to respond to these more distant structural causes of the crisis. And then you started to answer that just then, and I was wondering, in relationship to what you were saying about community-based action, whether you could sort of list for us some of the practical things that you're doing on the ground on one side, and then some of the perhaps more abstract principles that guide those practices on the other side. Yeah, like it seems that there are some really important practical lessons that emergency has learned from its work in other emergencies, in other crises, that you're applying to the pandemic crisis. But those lessons are both practical and principles.
Yeah, I mean, I think that in our experience, practice and principles have always been very much linked. Starting from the words that we're using, I was saying before that we have been told to respect the social distance, which is a word that I really hate. Mm-hmm. I said that we had to respect the physical distance, but socially, we have to be very close to each other. And there were ways to do it in a safe way. And for this reason, we translated the infection prevention and control rules that we developed during Ebola, for example, in Sierra Leone, into new guidelines adjusted to the new virus here for coronavirus. We made it. We made these guidelines very basic and very practical. Thanks to technology, we were able to organize like a lot of online training sessions. And this allowed a lot of people to feel empowered, mm-hmm. to help those who were close to them. Also physically, on this principle that we needed to help, because this was a huge problem for all of us. But at the same time, we have to do it in a responsible way, because a pandemic is not just like an earthquake, where everybody then can go and say a nice word to someone, to a survivor. A pandemic is something very serious, and if you just have good willingness, but you don't have the right skills, you can do a big damage. Mm-hmm. But with this system, we were able to share the values and also, let's say, elevate the skills of a lot of people. And the end result is that, for example, here in Milan, there was this very dishomogeneous group of youngsters, 300, 400 young people who wanted to help, but they didn't know how. Now, after 1.5 years, they constituted their own organization that has roots in all the different neighborhoods of the city. And they are starting to think about new projects to support their own communities. So it means that, it worked. And of course, we are still in this mentor phase, let's say, but we also learned a lot from their energy, enthusiasm, and willingness to help.
Thank you, Rosella. I think so interesting to also hear about the community action and the mobilization and the people-centered innovations. So, one of the last questions, and therefore, would be, if students and faculty of Right Livelihood colleges would want to collaborate with you, what would be the possible options to amplify the solutions, and what would you suggest?
Oh, first of all, thank you very much, because we would be really very happy to start this, to strengthen this collaboration with Right Livelihood colleges and students, where there might be many different ways. Also, in terms of something that we are not very good at is perhaps amplifying our message. So producing documents, material that can be then shared broadly, and perhaps this can be something that could be done with students, and also starting from the models that we have developed, trying to figure out possible evolutions of these projects and of this model. We are absolutely open, and try perhaps also how to adapt it to different contexts and different communities, because we know that this worked here in Italy, but perhaps to be effective in Mumbai or in Santa Cruz, they might need some adjustment, and this could be something quite interesting to discuss about.
Yeah, thank you. That's so encouraging. Yeah, Matt, you would want to go?
I just wanted to say thank you. That was really encouraging, as you say, Swati, and also, it was really inspiring. I really think our students and many people in our different communities will be inspired by these ideas. And we're so grateful to you, Rosella, for sharing your time with us this morning, this evening, your time, and look forward to more conversations ahead.
My pleasure. Thank you so much, and good luck to all the students.
Thank you. Thank you so much. It was wonderful listening to you. And I'm sure there are so many younger people who would be inspired by your talk. Thank you.